Good morning everyone, my name is Tyrone Roberts, Director of Nursing and Chief Officer here at Bury Care Organisation, and just wanted to say a few words to you on the back of it being Men's Health Week. So what a massive period we've been through over the last 15 to 16 months during the pandemic, and I think never more has the link between both mental health and physical health come more to the surface than previously. That said, I still think that particularly mental health is often seen as really quite taboo, and so just wanted to share a few personal comments with you in terms of me and how I manage my both physical and mental health. So physical health, some of you will be aware, about 3 years ago I went through a big programme of really learning around the food you eat, around healthy choices. I can't be a monk, I can't subscribe to things 100% of the time, and there is a mixture of reality there with life, but I'm certainly now aware of the choices I make and how I can plan, particularly planning and prepping food, and equally then still being able to enjoy some of the treats when you want those treats as well. I do weight training 3 times a week, and it just keeps me sane, and it kind of keeps me ticking over. My mental health, some of you, if you follow me on Twitter, will equally know that I'm being quite open, and over life, I think like most people, it can be a bit like a roller coaster. And I have had periods over the last 12, 18 months where my own mental health has struggled to an extent that I have sought help from my own GP. So I think sometimes we can just look at people and we can see an external perception that leads us to think that everyone else is okay, and therefore I'm absolutely not going to raise that or talk about something. So I just wanted to share with you, because I am quite active on social media and I will often share the stuff that makes me happy, which is spending time with family and friends. It is working out, it is doing stuff that makes me feel good, but that doesn't mean that actually it's always plain sailing, and it's that roller coaster of life, isn't it? So for those of you working here at the NCA, you'll know there's lots of stuff on offer from the SCARF programme, and that has been really taken well by staff. So, what works for me won't necessarily work for you, and we're all different. But I guess the message from me for Men's Health Week is, 1, don't let it be a taboo. If you break your arm, you'll seek help for it and wouldn't think twice. If you're struggling with aspects that can't be seen, such as mental health, that should be no reason why you can't come forward. It's not a sign of weakness. I think it's a sign of strength actually to come forward. It doesn't make you any less of a person. It's just a different way of how we're responding to life, which sometimes can be really challenging. So happy Men's Health Week. Thank you for everything that everyone does, and please look out for the offer and support that is here across the organisation, and hope it's been useful sharing some of my own experiences. Have a good week, everyone.